I'm Donna. I'm the founder and director of MomsHouse. Some of you know me, obviously, but some of you don't. So let me tell you what MomsHouse is. MomsHouse is an advocacy group for elder care, for elders, excuse me, not for elder care. Basically, what happened is I had an experience in my life that opened my eyes to the fact that there are a lot of elders out there that are not being handled or being attended to as I feel it should be. So my mom got MS, and well, she had MS when I was 8 years old. She struggled through, but when in 2007, 2008, she got really sick. 2008, I took some time off, and I had to stay home to take care of her because I had vowed never ever to let her go into any kind of senior facility. I was going to take care of her. But I didn't actually know what I was talking about because it's really, there are things that need to happen that I could not do. So inevitably I had to actually put her in a senior facility. But and I, since I had taken time off, had plenty of time to make sure everything was okay, to check the facilities out, to harass the nurses and the doctors to make sure she was getting the care she needed. But while I was there, I noticed there were plenty of people with nobody to advocate. And basically, when you're in that kind of situation, you need some help. You need somebody to speak up. You need the squeaky wheel. And so it was really sad to me. It broke my heart.
Yeah.
Okay. This is why I started MomsHouse, and it's twofold. It's basically going to help people advocate that need advocacy, but before that, we took it a step back, and we want to help you age actively so that we want to delay you having to go into any kind of facility. So we want to keep you active, keep you healthy, keep you engaged, keep you loving life and living life to the fullest. And we also want to help the next generation because there are so many people, youngsters, that are not benefiting from our elders' experience. I'm not quite sure why we decided we want to do it on our own as opposed to taking somebody's advice, but that's just kind of part of being stupid. So I want to make sure that we're all engaged with each other, that we're all taking care of each other. Have a seat. Although you're very cute, you're looking really good there. All right, so that's what MomsHouse does. Real quick, I'm going to introduce my volunteers because I've been working them to death. I got Sister Betty Sloan over there. Hi, everybody. I got Michael Shumpert. He's the cook. And the entertainment. His wife, who takes care of him. This is Janera. She's my whatever. My secretary. Okay. So anyway, she's taking care of the front. And then we got Mr. Watson over there. We got one more volunteer. There we go. We'll put everything together. I want to thank Ranger Village for letting us have the space and being so helpful, and jumping in and giving me suggestions, because I'm always open to suggestions. And I think I forgot to tell you one thing. The MomsHouse is a nonprofit. We've been in business since July of last year, so we're under a year. We are not 501c3 yet. We're waiting. We're in line. So the paperwork is in, and our lovely government is about 6 or 7 months behind. So I submitted my information November of last year. Now I'm just in the queue. So we're praying. Through all the prayers in there, we're praying for a speedy, I guess we're past speedy, but an approval soon. Okay, so we get that done. And okay. And I also want to thank our guest speaker, Ms. Karen Gilbert. Okay. She really helped me out. She stepped up, and she's gonna talk to you guys about Medi-care, Medi-cal. She is a assistant social worker. She's got a VA. She doesn't know anybody there. Okay. She works at Lancaster Adult Daycare Center. And she is going to take us into the next portion. She'll talk about Medi-care and Medi-cal. And there will be a question and answer after that. You guys should have an agenda so you can keep up with us and keep me online. And you should also have raffle tickets. Everybody should have a raffle ticket, so make sure, because we got some good prizes. Okay?
Yeah. All right, so I put some handouts over here just so you can follow along if you're interested. a lot of information. Alright, she just brought up a good point. Let me know if you can't hear me, because my voice is kind of quiet. That way I can speak louder.
We cannot hear you.
Just raise your hand and go.
Joni.
Oh. I was wondering why I was going to give it back to her.
So how's everyone doing today? Good. All right, good. So my name is Karen, and I want to start by letting you know that I don't work for Medi-cal or Medi-care or an insurance company, which is really good for you because I'm going to give you unbiased information, and I'm not going to try to sell you anything, and I'm not going to sign you up for a health plan after this. So what I do is I work for the Lancaster Adult Day Healthcare. And dealing with insurances is something I do every day. I usually talk to them, but I never actually talked about them. So this is going to be my first time talking about them. So bear with me because there might be some questions and answers out there that I might not know. But give me time because I will find out and I will get back to you. Okay? So with that being said, Medicare is such a complicated topic and there's so much information out there and it's so broad. Medi-cal, the rules, the laws, regulations are always changing. So it could become very overwhelming for a lot of seniors out there. So let me see what I'm working with. By a show of hands, who here is Medi Medi?
Who knows what Medi Medi is?
That's my next question. Yeah, my second question, who knows what Medi Medi is? And I guess only 2 people. All right, well, good. Then you guys can learn a lot today. All right, so I'm going to start by talking about Medi-cal first and Medi-care. So Medi-cal, I'm going to try to give you the basics on what I think is most important for you to know. So Medi-cal, what is it and how do you get it? So Medi-cal is basically free or low-cost health care insurance for the elderly, the disabled, and for families, and for children up to 21 years old. Now, there is something called share of cost Medi-cal, which also it depends on your monthly income. So, for example, a family of size of 1 that makes $600 a month or less, that person would qualify for free Medi-cal. Now, a family size of 2 that makes $934, these are actual numbers from the website, that makes $934, they'll qualify for Medi-cal. However, it would be share of cost Medi-cal. So this is where it gets tricky. What that means is that Medi-cal gives you an amount per month. So let's say this person share of cost is $800. So during that month, they have to pay up to $800 of medical services, whether it be your prescription, whatever you have to pay, up to $800. Now, once you hit the $800, then anything after that you spend on medical services, that's when Medi-cal kicks in and they'll pay for you. But you have to pay from your pocket all that time, all the money, until you hit your share of cost. Does that make sense? Yes. Okay, now, besides the Medi-cal, now there's all these health plans out there that depends on where you live and by zip code. The 2 main ones for LA County are Health Net and LA Care. Now, everything else like Anthem Blue Cross, Kaiser, Care First, LA Care, they all are plan partners and they fall under LA Care. So Molina Healthcare, that's a plan partner of Health Net, so they fall under Health Net. So for example, if you wanted to enroll with Kaiser, let's say, as a health plan, you wanted to enroll your Medi-cal with Kaiser, you will first enroll with LA Care, and then Kaiser will give you like a permission slip, so you can enroll your Medi-cal with Kaiser through LA Care. I know, it becomes really confusing. Yeah. So the next question is, well, why would I want to get a health plan? Do I need one? Should I get one? Well, it's really up to you and what your preferences are and what you're looking to get out of this health plan. So for example, where I work at, the Lancaster Adult Day Healthcare, we take Medi-cal. We take straight Medi-cal and most of the HMOs out there. So if somebody, let's say you're interested, some of the services we offer are physical therapy, occupational therapy, individualized nursing care, we offer transportation, we offer a breakfast, lunch, and a snack, activities, and social services like one-on-one counseling and support groups. So let's say you're interested in physical therapy and you wanted to come to our daycare. I would contact Medi-cal first, see if you have straight Medi-cal, and we can take you in and they'll pay for everything. And then they'll either say yes, go ahead and do it, or they'll tell me you have to sign up for managed care, or basically an HMO or a health plan. So that's when you get to decide, what do you want to get out of this health plan? Do you want to come to daycare because of the PT and OT or whatever other service, or just for the social aspect of it? Then you sign up for either the plans that we take, which is, we take SCAN, we take LA Care, Care First, Molina Healthcare, HealthNet, and we also have a contract with the Veterans Administration. So that's just another ballgame. So, yeah, so whatever you're looking to get out of this plan, some of these plans have different programs that added to the plan. So if that's, what you're interested in, then you should enroll in the plan. But you're also fine just having straight Medi-cal, because then anyone can see you and you don't have to be tied to a specific doctor or a clinic that you have to go to. Now, if you need more information about the health plans, or if you know a health plan that you want to enroll with and you're ready to enroll, I put the healthcare options phone number down so that you can contact them. It's the 1-800 number, and they'll help you enroll over the phone. And in addition, they'll give you information about the plans. So I got this little chart here from the Medi-cal website comparing different programs and services from the two main ones that I talked about for LA County, which is HealthNet and LA Care. So you can do your evaluation and decide what you need based on the services that you require or that you need. How do you apply? You can go to your nearest DPSS office, Department of Public Social Services, and there's one in Lancaster, it's Office 34. It's off of East Avenue K6. You can go in person, or if you're more efficient and you have internet access, you can download the application online. It is a PDF file though, so if you're gonna type in there, make sure you print it out, because it doesn't save. And make sure that if you're gonna send your application on the mail, that you get it a tracking number and maybe a signature, because we all know with big bureaucracies, paperwork tends to get misplaced. So that way you know for sure that your application made it there and you can track it. Alright? Alright, so that's about the health plans. Let's talk about Medi-care now. Medi-care is such a big subject. So basically there is traditional or original Medi-care, and then there is Medi-care supplemental plans, Medi-care Advantage plans, and then we got your Part A, your Part B, your Part C, and your Part D. Okay, so it gets really confusing. So the basics, Medi-care, it's health insurance for those 65 or older and under 65 with certain disabilities. Okay, like Lou Gehrig's disease and ESRD, I believe, the kidney disease. So how do you apply? How do you become eligible? Is it free? Well, traditional Medi-cal is the main one. Once you turn 65, or actually 3 months before you turn 65, they automatically send you your Medicare card with your Part A enrolled. They're enrolled in your Part A already, which is your hospital inpatient part. Now, is it free? Yes and no. You're entitled to your Part A if you have 40 work credits. What does that mean? So basically right now for 2014, if you make, for every $1,200 you make, you earn 1 credit. But the maximum number of credits you can earn in 1 year is 4, regardless of how much you make. So 4 times 10 equals 40. So you have to work at least 10 years to get your Part A Medicare, right? So you get that. Now, well, Karen, I was a stay-at-home mom. I never worked, or I don't think I have all the credits I need to have my Medicare Part A. It's okay. You can qualify and you can be eligible for your Part A through your deceased spouses or your divorced spouse's record. Yeah, they get them with that easy. You take what's yours. Yeah. You can become eligible through that. And then that's your Part A. Your Part B, you can enroll into a Part B. So your Part B is the doctor visits, outpatient. So if you know you're going to be taking some trips to the doctor, it's a good idea to enroll in Part B. Section